Then avoid exotic meats or bush meat for the current season, because you have Lassa fever as well. So it is always better to stay away from exotic meat, and whatever food you are eating, cook properly and eat the food. Then avoid sneezing to the hand or coughing to the hand. In case if you have a kerchief or a tissue paper, you can always use to cough or sneeze to that. If you do not have an access to that immediately, always try to sneeze or cough to the elbow like this. Then as I said, do not touch the surfaces unnecessarily. That includes door handles, knobs, rails, all those places. Avoid public gatherings or mass gatherings, because we never know who is infected. So those gatherings it will actually intensify the transmission of the virus. So for the time period, we understand that there are religious sentiments involved in it. Some people, marriage may be fixed or anything, but for that matter, it is just for a it's not small period of time. So at least you can be alive and healthy to do those things. Yes, exactly. So these are the main things what you should be doing for the prevention, and to keep up your immunity. I may recommend you can have vitamin C tablets as well. Yes, vitamin C. There is no direct evidence that vitamin C will prevent coronavirus infection, but vitamin C will give you or improve your immunity levels.
But so President Trump of America recently approved of chloroquine as a way of as a drug for COVID-19.
In fact, some of them say that it was actually a fake news. Some of them were making statement that it is a fake news, but I'm not sure whether it is a fake news or if it is a true news. But chloroquine, we don't use chloroquine much in Nigeria, and one of my pharmacist friend told me that chloroquine is banned in Nigeria. But I usually do my social media post. So 2 weeks back, in one of my posts, I had mentioned that some of the antivirals like lopinavir, ritonavir, oseltamivir, remdesivir, along with chloroquine, is being used in China to treat such cases. And chloroquine and remdesivir showed in vitro reaction to the virus. That means inside the lab, when they tested, it was giving good result. So, and we also have one case in India where a doctor was treated with lopinavir, ritonavir, oseltamivir, and chloroquine, and he was found tested negative. So my suggestion or my recommendation to the Ministry of Health also is that if there are provisions available, we can always try this in Nigeria as well.